Supersonics Money Transfer is giving you an unbeatable offer this Tobaski. Your family and friends can now send you monies from the whole of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tobaski, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe, USA, Canada, and Switzerland.
Report on the COVID-19 response. And as tradition goes, the Director of Health Promotion and Education, Mr. Morijai, who is the Chair of the Risk Communication and Community Engagement Subcommittee of our National Health Emergency Committee, will present the statement on behalf of the Honorable Minister of Health, Dr. Amadou Samate, who doubles as the Chair of the National Health Emergency Committee. Thank you very much, Mr. Njai. The floor is open.
Thank you very much, Prince Abubakar Aminata Sankano, Senior Communication Officer at the Ministry of Information, and also double as the member of the Risk Communication and Community Engagement Committee and the Strategic Communication Officer at the COVID-19 Response Coordination Secretariat. I am reading this statement on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate, on the current situation of COVID-19 response in the Gambia. The 104th National Situation Report, since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th of March 2020, when the country reported the first COVID-19 case. As of today, 20 new cases registered, or 24, sorry, I beg your pardon, 24 new cases registered, which is the highest reported in a single day, bringing to 170 total number of COVID-19 cases ever confirmed in the country. Of this number, 2 are key COVID-19 response staff from the National Public Health Laboratories. About 30% of the newly confirmed cases were at the send-off party hosted by an existing COVID-19 case. 1 new recovery has been registered after case 60 produced 2 consecutive negative test results. 149 new laboratory test results received, 64 from the Medical Research Council, the Gambia, and 85 from the National Public Health Laboratory. 107 tests negative, 32 returned positive, 24 new, and 8 repeat tests. And 10 became inconclusive or probable case, and of that number, 6 new and 4 repeats. While 34 persons were newly taken into quarantine, 1 person was discharged. The country currently has 665 people in quarantine, 101 active cases, and 13 probable cases, and a crude case fatality rate of 2.9%. Globally, since 31st December 2019 and as of 22nd July 2020, a total of 15,365,714 cases of COVID-19, which is in accordance with the applied case definition in the affected countries, have been reported. Of these deaths, 629,358 were registered, and 9,344,748 recovered from the disease. Senegal recorded 9,125 confirmed cases, 6,108 recoveries, and 177 deaths. In the Gambia, currently, we have 655 people in quarantine. A total of 4,515 tests were conducted, of which 170 are positive. 58 recoveries and 5 deaths. 1,110 people completed quarantine, while 1,002 out of 1,052 target contacts were traced, and 210 people completed follow-ups, which is people who are asymptomatic with travel history to affected countries. With regards to coordination, there are daily coordination meetings ongoing at both strategic and technical levels. On surveillance and laboratory, 24 new cases registered, making the highest reported in a single day, bringing to 170 the total number of confirmed COVID-19 cases ever confirmed in the country. On logistics, with support from the police, one of the cases who had absconded was traced and taken to a COVID-19 treatment center. On case management, currently, there are 102 active cases in the country. One new recovery has been registered of case 60 after producing 2 consecutive negative results. On risk communication and community engagement, 5 TV and 14 radio programs successfully conducted. 1 media press briefing conducted, that was yesterday. Influential leaders in 9 communities were engaged in radio phoning programs across the country. Summary of social media activities, 2 Facebook and 2 Twitter posts shared with a cumulative engagement of 13,070 people. Summary of calls made to 2025, a total of 64 calls received, 59 COVID-19 related, and 5 non-COVID-19 related. 5 booked for further follow-up by contact tracing teams, and 8 booked for further follow-up by the quarantine team. Regarding our next steps, the ministry will embark on the following activities as part of the next steps. There is a need to impose stringent lockdown measures in both Western 2 and Western 1 regions in order to curb the spread of the virus. This discussion is already on the table and decisions will be made on it. There is urgent need for the procurement of an online UPS for the molecular lab to ensure the continuity of sample processing even when there are sudden power outages. Infection prevention and control measures should be strictly adhered to in all public and private healthcare facilities across the country. The search for confirmed cases who continue to be at large needs to be intensified in order to halt the potential spread of the virus by them. There is a need to test all healthcare workers and patients at EFSTH, including in the polyclinic. There is a need to provide adequate stock of PPEs to all health facilities, and facilities that also have adequate stock need to ensure that the staff are adequately supplied. Health workers to observe all COVID-19 preventive measures, including the donning of appropriate PPEs at all times. There is a need to ensure that there is uninterrupted electricity supply, either by the procurement and installation of a solar system or the provision of a standby generator, which is also being discussed at the level. In conclusion, we would like to appeal to the Supreme Islamic Council to engage religious leaders to observe the precautionary measures such as social distancing, hand washing with soap and water, as well as the use of face masks during congregational prayers, including the impending Eid. We would like to remind the general public that wearing face masks will help to cut down COVID-19 transmission, and hence it is now mandatory for everyone in the country. With effect from Friday, 24th July 2020, it is going to be mandatory. We appeal to the public to cooperate with the security personnel in this trying moment, as it is all geared towards the containment of COVID-19 in the Gambia. Finally, we encourage the public to take offer of voluntary testing for COVID-19, and currently, the Minister of Health is working on identifying ideal locations and instructors for sample collection in collaboration with the regional health directorates and relevant partners so that these areas will be identified to facilitate sample collection. It is important that the general public to continue cooperating with the authorities on matters related to COVID-19 and its associated preventive and precautionary measures. We would like to send this message to the general public that COVID-19 is real, and for more information, people can call the 1025. I thank you for your kind attention.
Thank you very much, Director of Health Promotion and Education, and RCCE Chair Samuel Njai, for that elaborate update. Ladies and gentlemen of the COVID-19 Media Corps, the floor is open for questions. There are no questions. Countdown 5, 4, 3.
Yes, I have a few questions that I want to ask. One is with regards to the high spread of this disease at the Royal Hospital, that is in the Francis Smart Hospital. As of now, can you tell us how many nurses would help workers in the Francis Smart Hospital on that part of time, if you have the figure? And then also we want to know what is the main cause of this virus being spread by the Francis Smart Hospital? Because there's a scenario where this affected personnel should be taken to. But we are seeing that now the hospital is most affected. What leads to the affection of that hospital in this virus?
Thank you. I know as of the 19th of July 2020, we had 8 health workers and 14 health workers affected, and bulk of them were at AFSTH. As of yesterday, the information we got also, we had 2, that's about 16, and today I assume it might be between 1 and 2 for the Edward Francis Small Hospital. Overall, I will assume to be a figure of around 16 people. And then the team is still working hard to get to the contacts of those people who are affected. And as you know, the source is a local transmission, and then the source is within the health facility and the hospital, and perhaps we will not be able to, because the epidemiological evidence that has not come to us to say this is the exact cause, but it's also linked to the case 674. Case 74 was our own health worker who died of the virus, and because those people have been taking care of that individual, they may have come in contact with the individual and hence got the virus transmitted to them. That could be one aspect of it. And we know that with the nosocomial transmission, which is about or infection within the hospital setting, could either be through either the procedures or through the equipment, or it could be through contact with an individual, either a person who is admitted or somebody who is also a health worker but also harboring the virus. So the link, that particular, for us to say this is exactly what was the cause of the transmission would be difficult at this point in time. But our epidemiologists are working very hard to reach to the bottom of the source of infection. And when we get that information, we will get it to the media as soon as possible. I missed the other part of the question. Can you repeat your second question?
I wanted to know what causes the disease to be hospital being the center of the disease?
I think I explained that already. I explained that this is one of my explanations, that is linked to case 74. Yeah, so that was, yes.
And my name is Dr. Minushi from Jackets. Just an additional question to what he asked, because our frontliners are okay, are the ones now at the epicenter of the spread of this disease, and it's actually a cause for concern because they are the frontliners and they are the ones curing the people who are infected. So the disease is now growing at a faster rate in Edward Francis Small Teaching Hospital, where is the loose end? Do they not have enough equipment, or is it that something is wrong, or they are not observing the preventive measures as we expect them to? And as well going forward, we expect that strategies need to change because things are just getting worse. What are your future plans in terms of how we intend on taming the disease so that it will not grow further?
Thank you very much. Edward Francis Small Teaching Hospital, as I speak to you, is fully equipped when it comes to equipment and capacity. And then, as you know, local or nosocomial transmission within the hospital, what the team is currently doing is to find out the extent of the spread of the virus within the hospital and put in measures. And one of the things is to, for example, to fumigate the entire hospital, that some of the areas that we feel that's where we suspect perhaps that could be the source of transmission. Or we're also working very hard to make sure that the equipment that are provided, the PPEs that are provided to hospitals are being used by the healthcare workers. Perhaps they are there, people are not adhering to the precautionary measures. And maybe also they are not available at the time that those staff are also on duty. But this may be a thing of the time. We may be working on this to make sure to get the bottom of the bottom of the whole story. That's about the epidemiological information, who is involved, to what extent, and what is the source of the infection. So the epidemiologists are working around that and giving us that information. But as I show you, that our health facilities are provided with PPEs. Those facilities that do not also have adequate supplies, they are also have been encouraged to apply or to request for PPEs or any other material that they would require in their procedures, especially at health facilities. Those ones can be requested at the central medical stores through the chairperson of the Logistics and Security Committee, who is also the logistician for the entire COVID-19 response. So basically, our strategy is now we are encouraging the use of face masks. We're also encouraging physical distancing, and we're also encouraging hand washing, and also to make sure that we put in stringent measures before people enter into our facilities. As you rightly mentioned, our health workers are affected, and then recently, of this recent data, yesterday and today, we have seen a bit of a decline in AFSTH hospital, but we're also seeing an increase in other healthcare facilities. So we can say it's now moving from Edward Francis Small Hospital to other health facilities. So we still need to tighten our belts to ensure that we strengthen our strategies, especially with the focus on wearing of face masks, observance of physical distancing, and as well as washing hands with soap and water, and regular temperature checks at all entry points. Like, for example, in our central medical stores here. Before you enter in, they will ask you your mask, and they also have to sanitize, and they will take your temperature. These are things that we are trying to strengthen and intensify in all our healthcare institutions. We're also building capacities along the way, and we're also trying to provide, to ensure that staff that are exposed to work or that are doing work in their various facilities to be able to ensure that they put on PPEs at all times. So this is one of the things we put in place, and it's ongoing, and we're just trying to intensify monitoring and supervision of those interventions we are doing. We are also intensifying our community engagement activities at national, regional levels, and we are doing the continuous radio program, the phone programs. And interestingly, people are asking. And we are also planning to train and to engage traditional healers by the traditional medicine program. It's also another way of getting the messages across. We are also, from next week, we are going to be engaging the Supreme Islamic Council, as we did for the Corite. I think my colleague knows we did a lot of intervention with them, and we're going to revive our intervention in preparation for the Eid. So a lot of activities are ongoing. The school interventions are also ongoing. The Ministry of Basic and Secondary Education is also sensitizing the students, the teachers, and the Parent Teachers Association, Mothers Clubs, and the parent, and also the club, other structures that are within the school. So therefore, a lot of things are happening And I think we want to assure you that a lot of work will be done, and this cannot be done without the media. Obviously, we are going to work with the media. Whatever information we have as a package, it is the media that will help us to get it to the public. So we cannot also leave it behind. We will continue to work with you along the way. And it is you who can help us to change the behaviors of the people. And the only behavior that we want to focus now is the use of the face masks, which some may say is a challenge for them, but we want to encourage them to continue wearing the face masks, which is going to help us cut down transmission. Evidence have shown that the use of face masks, proper use of face masks, and also observance of physical distancing, you can cut down the transmission rate to 0. So meaning we have to continue to practice physical distancing and as well as wearing of face masks. Thank you.
Thank you. Just to add on our directors, actually, it's not only the Francis Small Teaching Hospital is affected, we have Medicare, and today we have Shara, and even pharmacies are involved. So even in pharmacies.
Just to intervene there a little bit, because first it started at the Edward Francis Small where we saw, health, practitioners getting infected. Why is it trickling down to other health, clinics? Would you say that is because Edward Francis Small Teaching Hospital doctors or nurses are working in these clinics as well?
No. Even before that one, we've been having cases from other private clinics. Because if you've been following our update, we've been encouraging private health clinics to report cases. So it's too late that now because they've come at epicenters. But the private clinics have been cooperating already, independent of what's going on at the EFT Health. So these are ongoing. It's just a matter of coincidence that all the two main state referral and 2 health centers become, epicenters.
And even now, National Public Health Laboratories also affected.
Even the National Public Health Laboratories affected. This everywhere. And also we've been talking about social distancing and then people should not be going to parties. We are doing it for them. You see, latest we have people who went to organize a set of partying in a club and they are all infected. So all these preventive measures are for the people. If they don't listen, it comes back to haunt them. And we are seeing that when our warnings, those who did not ignore them, and then basically they became the first victims. Just to emphasize that one. And also traditional healers. We say people should be going to the hospitals, for continuity of services, and that's very important. They'll be going to the private centers. And then now we are saying traditional healers, because some people will not go for Western clinic. They say, okay, I will not go to hospital for fear of COVID-19, but you go to the traditional healers. That's why we are engaging them. If they are not sure, they should report the health authority cooperating. So we are creating that avenue too, so as to cut the spread, at local level in case there are people who are scared of going to the hospital. But there is no need to concern. Still go to the hospitals and health centers. They are there for the citizens. Thank you, Director.
Thank you. Yes.
One quick one. At the level of the ministry, do you have any plan to have mass testing in the country, looking at the number of COVID-19 cases being increased and the socialization of our people?
Okay.
It's like, it is scary. Do you have any plan to have mass testing as well countries are doing?
In fact, I made it in the statement here that the ministry is working closely with partners to engage the regional authorities and structures for them to identify ideal locations for the conduct of sample collections. This is another way of mass testing. You collect samples, and then also you bring it for analysis. And interestingly, also the ministry is also working closely with MRC Gambia for the labs that they have in Upper River region and then in Kenaba. If they are functional, then the staff, the sample collection sites will now be transporting samples to those centers for analysis. So a lot of plans have been put in place. And currently for the treatment center also, we know that we have been using sanatorium, and now Lemon Creek also have been used as a treatment center because the number of cases are increasing. So we also have to use the Lemon Creek as an additional center, in addition to other centers like MRC and that way. So we're also putting a lot of plans to ensure that we're not being caught up by surprise. But we've put in certain strategies and plans with regards to case management, with regards to laboratory. That's why the laboratory at the National Public Health Laboratory is functional and operational with the required capacity and the equipment that are supposed to facilitate the work. That is already ongoing. Yeah.
Another point about testing, we have to encourage it. Right now, Gambia, we are doing it free of charge. Senegal, we charge. And it's the new norm. If you want to travel now everywhere, you have to do testing.
Yep.
At least 48 hours, if I'm not sure.
At least
72 hours.
yeah.
So Gambia, we are encouraging the citizens to take advantage of it. It is not knowing your status. I mean, it's the new norm, it's the new reality. If you don't test, you want to go to Senegal, they will not allow you to fly.
Yep.
So in Gambia, we are doing it free of charge. And like I said, this is a government that is considerate and then take advantage of it. And then, yeah, we may not even need mass testing, if everybody just come voluntarily and take the state's offer.
I agree with Sankano. We really want to encourage people to come out in their numbers. Right now, there is testing going on at Nearby Clinic, and then we are encouraging people to come out and then test and know their status. Personally, I tested today, and I'm waiting for the results. And then I encourage other people also to come forward and test. We can only act on strategy when we know our status. Like for example, we cannot say the Gambia is doing or is cutting down the number of cases because many people are not turning up for testing. But when everybody turn up for testing, out of the 1.2 million people or to about 2 million people, for example, I think if at least 95% of the people were able to turn up for testing, then we can be able to know our stand of COVID globally or in the African continent. So although we are reporting less compared to other countries, but we still need to come out in our numbers to do testing for us to know our status. That will be very helpful.
One final question for the rapporteur.
Yes, I want to ask with regards to QTV. We are told that they have a case of research. And I don't know whether you are part of a massive test or
As I speak to you, all those institutions that are affected, they sent in their staff and they've been tested. Testing started yesterday and today, and they are waiting for their results. So we don't want to specifically identify to say so and so, but wherever it happens, our contact tracing team will contact them, and Rapid Response Team will do the follow-up, and we encourage them to come forward for testing, and that has been done by the institutions that are affected. And one of the institutions also went further to close down the institution for a while until fumigation projects are done until the 27th of July that they will start operating. So this is another way of containing the virus within the institution. So a lot more of that will come. And then wherever those areas are affected, we will work with them to ensure that the fumigation processes are done, to at least to make the place safer for all of them and the people who are coming in. And this could be clients and as well as the staff that are working in those institutions. Thank you.
Okay, on that note, thank you very much. And then, like I said, we still encourage the use of masks. We want to see more beautiful masks, especially this Tabasco. And it's nice, it's now a fashion statement, the new norm. You can still protect yourself while looking sexy and elegant. I can see beautiful masks here and then keep going on and carry on the message. Thank you very much and see you tomorrow. Thank you.
Supersonic's money transfer is giving you an unbeatable offer this Tabasco. Your family and friends can now send you monies from the whole of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tabasco, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe, USA, Canada, and Switzerland this Tabasco. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. Support your own. Tabasco just got better with Supersonics Money Transfer.
Debunking COVID-19 myths. Myth 1.
Mi wulnani corona de langata baleño
alade corona anda leñol corona anda leydi corona anda sare corona ko fof jaggato anda balejo anda bodejo ayande leydi de kertuden fof no jogi corona Gambia ko hen tawa.
Myth 2.
aha hana ko gonga nyamugol laaj e renite coronavirus
alade nyamugol laaj renata mo wana gonga continent ko woni gonga kon continent loten juuɗe men ɗe ndiyam e sabunde acciten 1 meter distance hakkunde meɗen continent sartaji ɗi ɓe wi pour renen hoore men renen yimɓe ɓe.
Myth 3.
Aha an aɗo andi Gambia tawaka coronavirus o wata wurude e nguleke.
Alade corona wura e nguleki corona wura e ɓuɓol a yande leyɗe ɗe kerɗuɗe fof no jogui corona continent loted juuɗe men ɗen e sabunde waren ñaw o ka juuɗe meɗen te waten memu guite men ɗen kine ɗe e hunduko ko sabunade corona ko ɗo wallirta.
Myth 4.
mawɓe andani corona ko tufunde tun no woni ala ko dowre
ala de corona naka dowre dulaji gonno ɗo tunduji gonno ɗo eɓe jogui cases ji corona wona ka tufunde tun woodi de andiron ɗum noon.